Hi everyone, Christer here from Master One Thing. Today we have the honor to have Ross Pelton as a guest in the podcast. He has a background as a pharmacist and has written 12 health books. In today's podcast, we are going to discuss his recent book about rapamycin and the longevity effects behind it. I think it's great to start with Ross Pelton when it comes to this rapamycin series, because Ross has great talent in explaining things in a simple way, so it's much easier to understand if you're new to the topic. So welcome to the show, Ross. It's an honor to have you on.
I really appreciate the opportunity to spend some time with you, and hope we can provide some interesting information for your viewers.
Yeah, great. If we take a look at what rapamycin is, can you explain how it was discovered and what it is?
Sure. Well, rapamycin is a compound that's produced by a strain of soil bacteria. So it's not a pharmaceutical, something new made in the laboratory. This is something that occurs naturally in nature. It was actually discovered on Easter Island when a group of scientists traveled there a number of years ago, looking for sources for new antibiotics and new antifungal drugs. So they took a lot of soil samples on Easter Island and took them back to Canada to their labs. And they discovered that one of the soil bacteria, one of the strains of soil bacteria, produced this compound that they named rapamycin. And the name comes from the fact that the indigenous people on Easter Island call their home Rapa Nui. So they gave the name rapamycin to the drug. So it was being developed as an antifungal drug. And then they found out that it suppresses the immune system. So that caused them to stop all of the research. But a number of years later, it got FDA approved for people that get kidney transplants, because people who have an organ transplant need to be on immune suppressing drugs continually to prevent the rejection of their new organ. And so it's FDA approved for kidney transplant patients. And then samples of rapamycin were sent off to the National Cancer Institute. And they got very excited about it and actually put it on a fast track for research, because they discovered that rapamycin is the first example of a totally new type of chemotherapy. Most chemotherapy drugs are called cytotoxic. They kill. And they don't just kill cancer cells, they kill bone marrow cells and the cells that line your intestines. Any rapidly turning over cells get damaged with chemotherapy, with cytotoxic drugs. Rapamycin is not cytotoxic, it's cytostatic. It stops the cancer growth without all the killing. And so back in the early 2000s, the FDA approved rapamycin for the treatment of several different types of solid tumor cancers. These FDA approvals have kind of worked against getting rapamycin accepted and used as a life extension drug, because you usually don't give chemotherapy or a drug for prevention of organ rejection to people who are life extension enthusiasts. But a scientist did a study that really kind of broke open this whole new area of research when they found out that taking rapamycin just once a week instead of every single day results in some tremendous health benefits. And so there's been 25 or 30 years of research now into the mechanism of action of rapamycin. How does it do what it does? And how does it create life extension? And this has resulted in what I think is a far more important bit of information than just the drug rapamycin itself. Rapamycin is very interesting. It is the most effective life extension drug that's ever been discovered. But in understanding the mechanism of how it works, there's a totally new understanding of cellular metabolism, of life, and the aging process. So let's start at the beginning here. When rapamycin gets absorbed across a cellular membrane, it binds with a protein. So they named that protein mTOR. And mTOR stands for the mechanistic target of rapamycin. It's just the name they gave to this protein inside cells that rapamycin binds to. But it turns out that mTOR is a master signal compound inside cells that senses when nutrients are available to the cell. So when nutrients are available, mTOR sends out signals that says, use these nutrients to build, to grow, to proliferate, to make new cellular components. And the other half of the equation, in addition to mTOR, a Japanese scientist won the Nobel Prize for his discovery of autophagy. And autophagy is a mechanism inside cells that starts to get activated when nutrients are not available. And autophagy is the cellular mechanism where the cell is able to target old, misfolded, or damaged cellular components and break them down and either reutilize the cellular components to make new proteins and new enzymes and so forth, or get things out of the cell, detoxify the cell. So autophagy is a major mechanism of detoxification for every cell in your body. So for hundreds of thousands of years of mankind's evolution, this mTOR and autophagy were balanced and things were working well. But in the last several thousand years, there's been a number of changes in mankind. One is the domestication of animals and farming. And then more recently in World War II and after World War II, every household started to have refrigerators and freezers so you could store food. And then processed food industry got into gear. And now you can go and find food 24 hours a day in convenience stores, all this processed food. Those changes have made a significant difference. Our ancestral humans didn't get up in the morning and open the refrigerator and start to make breakfast. They had to constantly work every single day to find food. And so they didn't eat 3 meals a day. They maybe ate one meal a day, and sometimes they might have gone a couple of days without finding food. So that's the balance of mTOR and autophagy. But now people eat all the time. Breakfast, lunch, dinner, in between snacks, dessert, and alcohol drinks. And so now mTOR is constantly stimulated because people are eating all the time. So autophagy doesn't get activated. We don't get the detoxification. We don't get the revitalization and renewal of our body on a regular basis. That's totally out of balance in modern humans. And so rapamycin can help people rebalance that, because rapamycin goes into the cell, binds with mTOR and partially inhibits it. So the autophagy starts to be activated. And before we started the recording, you talked about your experience with intermittent fasting and time-restricted eating. And I talk about these things in my book because that's the natural way to bring mTOR and autophagy back into balance. Spend more time without nutrients coming in and condense the time that you consume nutrients into a smaller window of time, so you've got more time with no nutrients available, so autophagy gets activated. But a lot of people are not going to discipline themselves to fast, and rapamycin does this for you, and it's very effective. There are many animal models that show that rapamycin either slows down the aging process, all types of age-related diseases. It, in some cases, reverses them. So it's one of the most exciting things that's ever happened in the life extension anti-aging movement. And it's just starting to be recognized now, not as a cancer drug and not for organ transplant replacement, but one of the most important drugs for longevity. And it's not just increasing lifespan, it's increasing health span, more healthy years. And so that's the rapamycin story in a nutshell.
No, that was a really great summary of the Rapamycin and mTOR and also your book. Very, very good. If we go a little bit back on what you were talking about, that you said that high chronic doses versus intermittent weekly dosing, that the dose makes the difference.
Exactly.
Can you explain a little bit what you mean with that?
Sure. A scientist by the name of Joan Manick did the first human clinical trial that kind of broke open this whole area. She did a study with elderly adults and tried several different doses, some daily doses, some weekly doses, some high, some low. And she gave all of these participants the seasonal flu vaccine and then measured how their immune system responded. And it turns out that the people that were taking 5 milligrams once a week had about over a 20% boost in their immune system. And for elderly people to get a significant boost in the function of their immune system, that's very significant for their long-term health and their survival. So that was the first study that really explained that at the right dosage, taking 5 milligrams once a week was kind of the sweet spot where people got the biggest boost to their immune system. And so subsequent to that study, most people who take rapamycin are taking 6 milligrams once a week. It comes in 2 milligram tablets, so you take 3 tablets once a week. But I also want to emphasize that we don't have all the answers. This is such a new area. I would think that at some time in the future, we'll be able to individualize doses. So your dose optimum for you, Christopher, may be different than mine because we have different types of metabolism. And so we don't know the correct dosage. We don't even know the correct frequency. Should it be once a week or once every 10 days? We don't know these answers yet. Human clinical trials are just starting to get started, but taking 6 milligrams once a week seems to be a very safe and effective range for most people. And I'll tell your listeners the best place to get information about this and stay up to date on rapamycin. There's an online forum called rapamycin.news. And there's hundreds and hundreds of people taking rapamycin scientists and researchers weigh in on here. And there's a search term where you can put in a question and see if there's any comments on the forum already that address your question, or you can ask a new question, and people from all over the world are likely to respond. So Rapamycin News is something I like to tell people about because it's probably the best site to get in-depth information about rapamycin.
Yeah, really good recommendation there. I have also been on that site and got lots of good information there. So yeah, really good. But what doses are they using for organ transplant patients?
I'm not sure exactly what the dose is, but they take it every single day. But I'm not sure how high the dose is.
That's the difference between what people take in the longevity field and organ transplant patients. Yeah.
Because if you take it every single day, then you suppress mTOR a lot, and that's what then if you interfere or block mTOR totally, then you have immune system suppression. Because, for example, cancer is a proliferative disease. The cancer cells rapidly multiply. Well, mTOR signals use the nutrients to build and grow. If you block mTOR, you shut that down, so you shut down cancer metabolism also. So that's the mechanism and why it's used for cancer as a cancer drug. But there's in animal models, we find that virtually all types of age-related diseases, whether metabolic diseases, neurological diseases, different kinds of cancer, all types of diseases in animal models have responded well to rapamycin. So very exciting work going on. There's up at the University of Washington, they've started the dog aging process, or the dog aging trial. And they want to get 100,000 companion dogs entered into this trial, which is just people and their pets. And one of the unique things about studying dogs is that they live only about 1/7 as long as humans, so we can do the trial faster. And they have very similar biology to us in terms of cellular metabolism and proteins and enzymes and so forth. And the dog lives in the same environment as its owner. So that kind of takes a variable out of the research. And so they're collecting an enormous amount of data on dogs and the dog aging process, and hope to be able to translate that into human aging.
Do they dogs also take rapamycin once weekly, or?
Great question. There's one arm of the trial where they're testing rapamycin with the dogs, and the other part of the trial, they're just recording how much the dog eats, how often it eats, how often the owner has it exercise, everything they can think of to measure that will give them information about the health of the dog and the aging process of the dog is being recorded.
Okay. Do we know when that trial will be completed?
No, I just spoke with the organizer of the trial, and they are still accepting dogs. You can go online to Dog Aging Project and click on a link if you want to enroll your dog. And there's a form you fill out, and the breed of your dog and the weight of your dog and the health history of your dog, and then they decide if he's appropriate to be included in the trial. But they're still looking for participants. And just have people search for the Dog Aging Project.
I will put that up in the link in the description, so it's easy to find. Regarding rapamycin, what would you say is the common misconception regarding rapamycin?
It's a good question. Yeah, the common misconception is that, first of all, most physicians aren't familiar with it. It's a prescription drug. You have to get a prescription for it. Most doctors aren't willing to write a prescription for it because they haven't heard of it. And the doctors that have heard of it are mostly familiar with it as chemotherapy or organ transplant. So they're not familiar with how it can give health benefits when it's just taken episodically, one dose per week. So it's an educational process. And that's what my book is designed to do, to accelerate people's learning curve about rapamycin. One thing that happened, I'll share with you. There's a doctor in Houston, Texas, has a big wellness center. His name is Dr. Steve Holtze, and the Holtze Wellness Center. One of his doctors read my book, and he brought it to Dr. Holtze and said, "You've got to read this book." Dr. Holtze read it and realized how important it is. He purchased 600 copies of my book and sent them out to 600 different physicians. So that's one example of how the word starts to spread. And now a number of the doctors at the Holtze Clinic are using rapamycin themselves, and they're prescribed it for some of their patients or their guests that come to their clinic. And of course, I get on podcasts and interviews and talk shows and talk about it whenever I can to spread the word, and encourage people that buy my book to tell other people about it. It's a word of mouth educational process.
When do you think it will be, what do you say, more that the knowledge about it will have increased that much that physicians know the difference between different dose protocols and the different effects?
Yeah, it's hard to make an accurate guess about that. In some ways, this is a revolution in our understanding of cellular metabolism with mTOR and autophagy and the aging process. And revolutions take time. Like Isaac Newton's new theories took decades to be understood and accepted, and Einstein's ideas took decades. And so this is a new theory and a new field of research. And so I'm just dedicated and passionate about working for the rest of my life to educate people about it. I send out proposals to be a speaker at different medical conferences and health conferences so I can get in front of audiences and explain this. And I take advantage of invitations like you've offered me so I can get on here and talk about it, and you spread the word through your network. So it's an educational process for sure. For people that have trouble finding a doctor who will write a prescription for rapamycin, there are some doctors in the US that will do telemedicine conference calls with the patient. And I think the one I'm most familiar with, the doctor charges $150, and at the end of the conference call, he will write and send the person a 3-month prescription for rapamycin. Alan Green is a physician that I profiled in my book, and he's a very knowledgeable physician about rapamycin. He had a lot of health problems himself and started taking rapamycin, got tremendous improvement in his own health. He now has over 1,200 patients taking rapamycin. So that's having a big effect, I think.
He wasn't he one of the first physicians who started to move this field forward?
I think, yes, he's been a key figure. Another thing I'll mention to people, some people who don't find a doctor who will write a prescription for rapamycin for them. On the online forum, Rapamycin News, there's a lot of people that talk about ordering rapamycin without a prescription from generic drug companies in India. And all of the reports are pretty positive. It takes 6 to 8 weeks for them to get their shipment in the mail, but they come through. It's not being confiscated by customs and immigration. And so a lot of people are, I think an increasing number of people are just getting rapamycin from some of these overseas drug companies.
Are you taking rapamycin?
Sure, I've been taking it for almost 2 years now.
2 years? Oh.
And a lot of people ask, well, what do you feel? And I've had some weight loss, and the animal experiments document the fact that the primary weight loss comes from visceral abdominal fat around the waist area. That's the type of fat you want to lose, so that's a good thing. But in terms of actually feeling different, on a day-to-day basis, you don't feel any different, but I try to get people to understand the science behind it. It's like when you take a dose of vitamin C or you take your vitamin D capsule, do you feel any different the next day? You probably don't, but you take it because you understand why it's important. And so that's why rapamycin is important. It's not so much for huge benefits all at once. It's day by day by day, slowing down your biological aging process. Every cell in your body starts to work better when you start to get activation of autophagy, which is starting to detoxify cells and utilize cellular components to build healthy new proteins and healthy new enzymes. And when you don't activate autophagy, the cells start to get clogged up with damaged cellular components that aren't working well. Proteins get misfolded and enzymes can't work correctly. And so this is really revitalization and renewal of your body when you start to reactivate autophagy.
What dose protocol are you on currently?
I'm taking 3 tablets, 6 milligrams once per week.
And have you felt any side effects or anything like that?
No, no side effects. But that's a good point to bring up, Krister. It is possible to take too much rapamycin, and 6 milligrams for me seems to be fine, but 6 milligrams for somebody else could possibly be too much, because if somebody is doing intermittent fasting and strength training and lots of different things, maybe they don't need quite as much rapamycin. The side effects to look for are low levels of hemoglobin, low iron count in your blood test, elevated triglyceride levels. So lab tests can track some of your progress and be a warning flag if some of those things start to get out of the normal range on your blood tests.
Yeah, so taking before people start, they should do blood tests so they know the baseline and see.
That's always a good idea. Yeah, I'm glad you brought that up. It's a good idea to have a baseline, and I would rather have people work with a physician so that physicians start to get familiar with it also. But I certainly understand a lot of people wanting to take it on their own recognizance if they can't find a physician that will work with them.
That sounds good. When you decided to start taking rapamycin, you said it was around 2 years ago. If we look at the human research, it's still quite early. We need more research, as you said. We don't have all the answers. So it's always a little bit a risk to take something that we don't know so much about. How was your thoughts around that when you took that decision to take to go into an area where you don't know that much yet?
Well, I've known about rapamycin for 6 or 7 years. I first learned about it when I was attending a life extension conference in Las Vegas, way before COVID, about 5 or 6 years ago. So I kind of knew about it, but I really hadn't studied it a lot. But 2 years ago, something sparked my interest. I listened to a couple of podcasts on the Peter Attia program. He has a podcast called The Drive, and he interviewed Matt Kaberlein and Joan Manick, some of the key scientists in rapamycin field. And listening to those podcasts and the scientists that have been studying and working with rapamycin, I got a firmer understanding of the science behind it and why it works. And because I'm a pharmacist, I have a background in biochemistry, and so all this stuff started to make sense. And so I started to pay more attention to rapamycin and be more aggressive about finding more information about it. And then one day I realized there have been thousands and thousands of scientific papers written on mTOR and rapamycin and autophagy, but nobody'd written a book about it. Nobody explained it to the general public. So that became my passion, and I wrote this book, which has most of the significant research and the history of it, how it was discovered, and different types of diseases that it can potentially help. And so that was my path and where I developed this passion to write this book.
Yeah, so that's quite a great thing, because then not everyone needs to dig so deep as you did. They can read the book to begin with and get a quite good picture about the area.
Exactly, yeah. And when we're done with our interview here, Krista, I'll send you links to several articles that have been written. One is an interview with me that was published in Life Extension magazine. And then I've had articles that I wrote that were published in a couple of different medical journals. And I can send the links to you so that you can post those on the show notes. And then if people want to learn more, they could read one of these articles, which is like 4, 5, 6 pages. And that might stimulate them in their interest to go out and purchase the book.
Yeah, really good, really good. If we, one thing that I know that you practice fasting, as I do, and one side effect that can happen is that it creates some kind of insulin resistance, pseudo diabetes. Can that also happen when it comes to rapamycin?
I've not been familiar with that. I haven't heard of that happening as a side effect of rapamycin. Um, I really got much more interested in fasting as a result of learning about it in the process of writing my book. And so since I'm a healthcare educator and pharmacist and so on, I've known about fasting for decades, but I just thought it would be a miserable experience being hungry all the time. But about 6 months ago, I started experimenting with fasting myself. I've been doing the 16-8 program for quite a while since I started writing my book. But my wife was gone for a couple of weeks on a actually a Spanish language intensive. So she was gone for a couple of weeks. So I decided one week I would try a 2-day fast. So I went 48 hours, 2 complete days, with only drinking water or herbal tea or coffee with no other additives. I was amazed at how easy it was for me. And the following week, I did a 3-day fast. So I'm not saying it's going to be easy for everyone, but for me, a 2 or 3-day fast is very easy. And I realized that, like most people, I like my food. So I'll walk into the kitchen and grab a handful of nuts or have a piece of fruit. And yet when I set my mind to not eat, it was easy for me to turn it off. And so I probably will do a 2 or 3-day fast, maybe once every 6 weeks or so for the rest of my life. I think it's a very good thing to do a little bit longer fast occasionally.
And if we look at there are some similarities between fasting and rapamycin, that they both, for example, inhibit mTOR and activate autophagy. Can you explain a little bit around that?
Exactly. Well, you explained it pretty well yourself. Rapamycin binds to mTOR and activates autophagy. So rapamycin is a calorie restriction mimetic, because when you restrict calories, mTOR doesn't get activated, autophagy does get activated. That's the same thing that rapamycin does. It stops mTOR and activates autophagy. So they call rapamycin a calorie restriction or a fasting mimetic, because it essentially does the same thing. It shuts down mTOR and activates autophagy.
One question that I think the audience is interested in then is that why take rapamycin if I can fast instead?
That's a good question, and we don't have all the answers yet. But in my mind, I want to do everything possible to improve my health and slow down my process of biological aging. So in addition to fasting, I also do rapamycin. I also lift weights and work out regularly. Exercise is critically important. And I'm fanatical about eating healthy, organically grown food. And there's a lot of different parts of health and life extension, not just rapamycin. So I advocate what I call an integrative life extension program. And maybe on another episode sometime, we could talk about a couple of other topics, like glutathione is incredibly important. It's one of the most important multitasking compounds in the body, and it regulates all your detoxification. It's the most prevalent antioxidant in your body. It very strong antiviral characteristics. So that's another whole topic. I'm very passionate about the gut microbiome. And I'll send a link that you can supply on the show notes. I've recently written an article, The Microbiome Theory of Aging. And this got published in a medical journal called Integrative Medicine. And encourage everybody to read it, because it talks about all the problems that happen when people do not create and maintain a healthy gut microbiome. And my company that I'm the scientific director for is named Essential Formulas. They're based in Dallas, Texas. And they have what I think is the best probiotic in the world, called Dr. Ohhira's Probiotics. It's made in Japan utilizing a multi-year fermentation process. They have big 80-gallon fermentation vats, And they add lots of different types of Japanese fruits and vegetables and mushrooms and seaweeds and 12 starter strains of bacteria. And the bacteria get to digest and ferment these foods for 3 to 5 years before they encapsulate the product. And during that fermentation process, the bacteria are breaking down some of the components in the food and creating what we call postbiotic metabolites. These are critical health regulating compounds. It's not the bacteria, but it's the compounds the bacteria make that are really critical health regulating compounds. And so Dr. Ohira's fermentation process really mimics the fermentation process that goes on in the human digestive tract and the colon. So it's but can talk about more about that at another time, but I'll send you some links so people can get some free information. I've got a booklet I wrote about that people can get the free booklet.
Yeah, you have a big bookshelf with 12 books, Ross. That's great. One thing about the other mTOR inhibitors, like you talked about exercise. When you do exercise, you trigger inhibition of mTOR when you do the exercise, but when on the recovery phase, you build up the muscles. There are lots of different ways to inhibit mTOR, like also, I think sauna use, warm exposure.
So yeah, and I have an infrared sauna downstairs that I use regularly. Another way to do it is cold.
Yeah, exactly.
I don't like cold, but if you jump into freezing water, it stresses your body to produce heat shock proteins, and that's known to be a life extension protocol. And some people go from hot to cold back and forth, but I can't stand the cold, but I do infrared saunas on a regular basis. That's another really good procedure. And I think in Finland and over in the Scandinavian countries, you people are much more advocates of regular sauna use.
Yeah, my parents are from Finland, so we have the sauna culture there. So I have it in my blood. I love the warm exposure, but I try also to push myself to take the cold showers and things like that too. Yeah. And also other things you mentioned, like food ingredients, like I think is garlic, for example, mTOR
There's
inhibitor.
A lot of foods like that. In my microbiome theory of aging, I talk about the diet for your microbiome. It's a real paradigm shift starting to happen. For many decades, people think about the food they eat in terms of carbohydrates, fats, and proteins, the macronutrients, or vitamins and minerals and trace minerals and essential fatty acids and amino acids and so forth. They think about the nutrients that they need for their biochemistry. But what's starting to be recognized as equally important, every time you eat, you're feeding 100 trillion guests, the 100 trillion bacteria in your gastrointestinal system, in your microbiome. And I have numerous studies that say that 90 to 95% of American children and adults do not consume enough of the types of food that feed their microbiome. And it's primarily plant-based foods that contain dietary fibers and polyphenols. Those are the two main food groups for your microbiome. But most people aren't eating those. Excuse me, let me get rid of a call here.
No problem.
So with most people not consuming adequate amounts of plant-based foods, and fast food restaurants are just everywhere. I did some research and found out that there's an average of 4,000 fast food restaurants in every state in the United States. I don't know how widespread they are in Europe, but millions and millions of people are eating fast food, junk food, processed food all the time. And so,
you can call it mTOR food.
Yeah, but it's not feeding their microbiome.
No.
When they have an upset microbiome, my microbiome theory of aging talks about the cascade of events that lead to accelerated aging when you don't have a good, healthy microbiome. And with people eating the wrong types of food, they have the more bad bacteria than good bacteria, and that creates gut inflammation, that causes intestinal permeability and lots of health problems. And we have an epidemic of epidemics. The health of mankind is not doing well. We've got an epidemic of heart disease and diabetes and cardiovascular disease and ADD and ADHD and autism and rheumatism, arthritis. There's all these diseases that are critical, and a lot of the reason is that people are not eating a healthy diet and keeping and maintaining a healthy gut microbiome.
And how is it if the mTOR is overexpressed? Does it get does the mTOR increase year by year when you get older, or?
I don't know the answer. I haven't seen any studies on that. The thing that seems to be more prevalent is that just people eat all the time. And so mTOR is constantly being overexpressed and autophagy is not getting activated. I haven't seen any studies that talk about it over time as people age, and that's a good thing to
accelerates the aging then, or?
Pardon?
Does that accelerate aging?
It accelerates the aging process. When mTOR is constantly overactivated, it accelerates tissue breakdown, and all the diseases of mankind are to some degree related to overactivation of mTOR.
And when you take, for example, rapamycin, exercise, practice fasting, cold exposure, and things like that, you talked a little bit about that you can do too much of that. How do you know when you do too much of the autophagy?
Number one, track how you feel. And if you feel that something's not right, then that's your first indicator. But I also encourage people, like we talked a little bit earlier, blood tests. Get your lab work done. Have a good baseline of lab work done beforehand. And then maybe 6 weeks after you start rapamycin, get another lab test and compare the two. Make sure you're not getting low hemoglobin, low iron levels, elevated triglycerides. Those are some of the things to look for.
Yeah, that's very good tips there. What is the most common question you get around rapamycin, if we go back to that?
How can I find a doctor to write a prescription for rapamycin for me?
And your answer is buy my book.
Well, yes, because what I do, I say, buy my book, give it to your physician so your physician can get educated about it. So your physician can see there's good, solid science explaining why occasionally taking rapamycin once a week rather than daily provides significant health benefits. It explains mTOR and autophagy, and then it all starts to make sense.
Is there some people that shouldn't take rapamycin?
That's a good question, Krista. I'm glad you brought that up. You'd never give mTOR to children or even young adults, because that's a time of rapid growth phase. And if you block mTOR, you're interfering with that. So I don't think it's appropriate for people to start taking rapamycin until they're young adults to middle age. It varies depending on their health problems and so forth. But I'd say late 20s, early 30s is a fine time for most people to start considering taking rapamycin.
Yeah. I have recently started my rapamycin journey also. So I started with 1 milligram weekly. So, and I ease up my dose slowly. How do you? I have heard that some start with the target dose directly, and some use the easing strategy. Have you heard if one is better than the other, or?
I'm familiar with what you're discussing. I haven't seen any studies that determines that one is better than the other. And there's nothing wrong with starting out at a low dose and gradually increasing it. But in my experience, people have not experienced problems by starting right away with 6 milligrams once per week. So I recommend that. But if people want to be a little more cautious, then they can start low and gradually build up to it.
I think in most cases, Alan Green prescribes the target dose directly.
And Alan Green is now recommending that elderly people can probably benefit by taking even larger doses, maybe as much as 10 milligrams once a week. I don't have any personal experience with that, so I'm not recommending it yet, but I'm keeping an eye on all the comments from Dr. Green, and hopefully he'll be posting some of the results from his patients that are taking higher doses, and we'll learn more.
Do you know why elderly people should take higher doses?
I don't know the rationale for it. I don't know. I haven't asked Dr. Green, but that's a good question to ask on the rapamycin.news forum. See what he responds.
Yeah, I will. The goal is to also interview Alan Green in this rapamycin series. So let's ask him when he is guest in this
I spoke
podcast.
with him just about a week ago, and he's also writing a book right now. So it'll be interesting when his book comes out.
When will that be published?
He doesn't know yet. He's still involved in the writing process. So but he'll notify us when it's ready.
And your book was you published a book last year.
Last year, and we're getting ready to do a second edition of it. So probably maybe 2-3 weeks we're doing a second edition. I'm going to have some new information in the second edition. There's so much research coming out so fast, it's hard to keep up.
That's and we will probably can have another interview also in the future about the new stuff in the second edition.
Yeah, I'd like that.
Yeah, great. But really great conversation about the rapamycin field. I think we have given the general public a little bit better knowledge about rapamycin and its potential longevity effects. And in your book, they can read more in detail about what it is and studies behind, and yeah, different tips and tricks that you have gathered.
If people want to order my book, they can call Life Extension, and in addition to ordering my book, they'll get a free 6-month prescription to the Life Extension magazine.
Ah, okay.
So I'll send that information for you to post on the show notes after we're done.
That's great. How can people find you online, Ross?
My personal website is naturalpharmacist.net. My bio and my blog and there on my website.
Okay, I will put that also in the show notes so that people can find it. Great. Then take care, my friend, and I hope you all well.
You too, Christopher. Thank you for the opportunity to speak with you, and we'll touch base again.
Disclaimer. The podcast is for general information and educational purposes only, and is not medical advice for you or others. The use of information and other things linked to the podcast is at the user's own risk. Always consult your physician with anything you do regarding your health or medical conditions.